Production funding is provided by A. Reddix and Associates, Health Information Resource Center, offering short-term training for long-term professional careers in medical coding. HIRCVA.net.
Discussing the issues and celebrating the successes of the African American community. This is Another View.
Hello everyone, I'm Barbara Hamley. Welcome to Another View. When I was growing up, those who had it would say, "My sugar is high." They were talking about diabetes. According to the CDC, up to 1/3 of all Americans are on the way to becoming diabetic by 2050 if we don't get obesity under control. Now, diabetes runs rampant in the African American community, with blacks twice as likely to have the disease as whites. So what does all of this mean? Our guests today all share personal knowledge about diabetes. Please welcome Barbara Sierra, news anchor with WTKR News Channel 3. Andre Parson, Director of Microvascular Research with the EVMS Strelitz Diabetes Center, and Matthew Boursier, Physician Assistant, also with the Strelitz Center. Welcome to Another View, everyone. How you doing today?
Thank you. Nice to be here.
Now, Barbara, people going, news anchor, diabetes, you have a very personal story to tell.
One that you know too well, Barbara, because you knew my father, Robert, and he used to call you his girlfriend.
Absolutely.
When he came to visit. And you know, one of the strange things that happened to him when he was in his 40s is he developed type 2 diabetes. And he always used to say to the rest of the family, you know, this is going to happen to you if you don't get your weight under control. And we never really understood at that point the association between weight and the onset of type 2 diabetes. But in watching him, we knew what could happen.
And he suffered a lot of complications based on diabetes, didn't he?
Oh, he just had the trifecta. He had diabetes, and he was insulin dependent. He had heart disease, and he had high blood pressure. So the combination of all of those things led to his death. And you know, so we're very much aware. I co-chair a walk every year to just encourage education, to make sure the community knows that, you know, if it hit that close to home in my family, I don't want it to happen in yours.
Do you worry about it affecting you? Are you tested?
Absolutely, I worry about that, because not only my father, but his sister died from complications of diabetes. She was a double amputee. Now, this was back in the day when, you know, they really didn't know as much as they know now, and thank God for the research that's going on right now. But, you know, rather than deal with it in ways that we can today, they basically surgically removed her legs, but the diabetes eventually went
out. Matthew, what are the symptoms? We talk about type 1 diabetes and type 2 diabetes. Let's talk about the difference between the two.
Sure. Well, basically, diabetes is a metabolic disorder where the body doesn't make enough insulin in type 2 diabetes to actually process all the blood sugars in the body properly. In type 1 diabetes, the effect is much more dramatic, and the pancreas doesn't essentially make any insulin to process the blood sugars. In the end, both in type 1 and type 2 diabetes, the patient or the person ends up with elevated blood sugars, and this is the hallmark of diabetes.
And that's the big deal. We have a couple of boards where we could talk about the symptoms for both types. Type 1, frequent urination, unusual thirst, extreme hunger, unusual weight loss, extreme fatigue, and irritability. And these came from the American Diabetes Association. And then type 2 diabetes, any of the above, as well as frequent infections, blurred vision, cuts and bruises that are slow to heal, tingling, numbness in the hands and feet, recurring skin, gum, or bladder infections. So type 2 diabetes usually affects adults, is that right?
That is the case. However, there is unfortunately a prevalence in people with, or there's a prevalence in teenagers. So many teenagers are actually developing type 2 diabetes.
Because of being overweight?
Right. So before, generally, you might have heard the term juvenile diabetes. That was generally younger people usually got type 1 diabetes. But now, unfortunately, our teens are eating more, they're becoming overweight, and they are developing symptoms of type 2 diabetes, or actually developing the diabetes itself.
So type 2 diabetes is the most prevalent, correct? Is that correct, Matthew?
Absolutely. It accounts for about 90 to 95% of the cases. And what I'd like to add is sometimes the only symptom that we see in men coming in is a new onset of erectile dysfunction. That brings a lot of
Really?
it in.
So none of the tingling, none of the appetite issues and fatigue and all of that?
A surprising number of people feel fine, in fact, great. And when we tell them they have diabetes, they just don't believe us.
So what types of testing, what should you do when you go to the doctor? What kind of tests do they give you so you can discover if you have diabetes or not?
Well, the simplest is either a urine or blood test. In the urine test, you'd see if the urine is actually spilling over, or the blood sugars are actually spilling over into the urine. And this occurs when they get to a certain peak level and then they start spilling over. You can also do a blood test, and if your blood sugar on 2 occasions is higher than 126 milligrams per deciliter, that's diagnostic of diabetes. Or if you have one single blood sugar measurement of 200 milligrams per deciliter or over, that's diagnostic.
So is this something that you should have tested, like you do your mammograms and your pap smears and everything else? I mean, do you do that on a every yearly basis?
You should, yes, especially if there's a family history. But if you go for a yearly physical, there should be routine blood work done, and that should include a blood sugar reading.
Yeah, my biggest fear is them actually declaring that I am pre-diabetic. You know, that seems to be the red flag for most of my family members before something actually occurs where there's a diagnosis.
And we see a lot of this because it affects 57 million Americans. And this is much more than actual type 2 and type 1 diabetes put together.
Barbara, explain pre-diabetes. What exactly does that mean?
Just before the horn blows, you know, basically. and that's, you know, that's the best way I can describe it. It's just before you get declared to be a type 2 diabetic.
Yes, and a lot of times we don't even see problems with blood sugars. What we'll see first is problems in the nerves, and that can actually occur, tingling, numbness, and pain in the feet, and we can see that more than a decade before the overt diabetes presents itself.
Now, Henri, you specialize in research. You're the one who's trying to figure out how we can combat and or eliminate this disease, is that?
Well,
maybe, maybe one day.
Specifically, we deal with diabetic neuropathy, and so there are lots of complications of diabetes. You know, you can have your nephropathy, kidney disease. You can have retinopathy, eye disease, and they're all, you know, nerve diseases. But specifically, we deal with the loss of function in the nerve fibers of the feet, the hands, and things like that.
And that's what used to happen back in the day, as Barbara said,
right.
when people used to have their limbs amputated because there was no blood circulating to this area. Is that what happens?
That's true. So people would often, you know, step on a nail and not feel it, and then they would develop gangrene. And so in order to save that person's life, you would have to amputate that limb or that toe. And unfortunately, once you have one amputation, you are predisposed to go on to get other amputations. So basically, the research we do at the Strelitz Diabetes Center is we investigate diabetic neuropathy. We look at the underlying factors of what cause it and hopes to try to prevent it and sometimes cure it.
I want to ask this question, and I hope this doesn't sound insensitive, but everything, it seems, that whenever a disease hits the black community, if everybody else has a cold, we have pneumonia. Why is there something about the African American body type, anything that is causing such a bigger incidence of this disease versus the white community or any other ethnic group for that matter?
Well, actually, that's one of the things that we're very interested in. So we have done studies with minority populations, trying to investigate, you know, that very question that you're asking. So we looked at microvascular disease in different populations, Caucasians versus African Americans, and we find that African Americans, they do have diminished blood flow on a regular basis in normal, healthy, control African Americans. So what we think is that, you know, because of our microvascular system, once an African American does develop neuropathy, it is that much worse than another population.
And if I can add, Dr. Venick, who you work with very closely on this, invited my father to participate in the clinical trials back in year 2000, I believe it was. And, you know, it's about getting the African American community to participate in these things as well. There seems to be some level of fear that he had. He didn't want to get involved. He didn't, you know, there was a fear engaged with the medical community. So I think that's also another mountain that we have to climb in terms of finding a cure. We have to be in the game.
And I was going to ask, because I would probably imagine, especially for older African Americans, when they remember things like the Tuskegee experiments and so forth, that it makes it harder for those clinical trials. Since you're involved with the Diabetes Association, is there something that you all are doing to try to dispel that myth or to try to get more people?
Yeah, we're trying to start with the youth, as we were talking about earlier, because we think it's all about education and getting children to know, specifically children in the minority community, to understand what the disease is, what you can do to help prevent it if you're predisposed. And the whole obesity epidemic that's hit our community anyway is a part of the fiber of what makes this happen to us more. And so we're actually trying to encourage them to have good eating habits and good exercise habits and just get up off the couch.
Get up off the couch for sure. Okay, Matt, so we have diabetes. Now what? How do you live with this disease?
Well, I think you got to individualize the treatment. The way you treat somebody who has diabetes who is 80 is different than the way you treat somebody who has 30. And you'd also treat somebody differently if they have type 1 and type 2 diabetes. I think in the African American community, there's a big issue, and Henri touched upon this earlier, and so did you, Barbara, that neuropathy, African Americans do not get neuropathy more often than Caucasians do, but when they get it to a more severe degree, to the point where they develop ulcers and eventually amputations. And the question becomes, how do we prevent that? And if I have somebody with diabetes who's African American who comes into the clinic that I work, the thing that I'm absolutely going to do is test them for neuropathy. And what I'm going to use to do that is a monofilament to do that. Just like this. You can actually make this out of fishing line, cut it to 8 centimeters, and you test the feet. And even more than that, what I can do is get you to cut your own fishing line and test your own feet. And by doing that, if you're African American...
So if you can't feel that run across your foot,
yes,
then that indicates to you that there's a problem.
Yes. Actually, you'd want to test both feet because diabetic peripheral neuropathy affects both feet, not just one side. And if you monitor these things at home, if an African American patient with diabetes and neuropathy test their feet at home every day, they can reduce their occurrence of foot ulcers by up to 60%.
Wow.
Wow. What about these, I see the advertisements all the time for the test strips and the blood test thing, and you know, the arm versus the fingers and so forth. Is one better than the other? How do you know what you need to use? And that's up to
I can try to answer that question.
Okay.
Test strips aren't necessarily very accurate, but they do give you a ballpark figure of where you are. And I've joked with my wife before that if you want a different reading from one of the test strips, you just take your blood sugar again, because there's a big variability. But it should give you an idea of where you are.
Okay.
So,
and that lets you know what? That you need to eat more sugar, less sugar? What does it tell you? I guess what I'm trying to get to.
For a lot of our patients, we get them to test their blood sugars in the morning because that's just a very convenient time to do it. And if they're on insulin, we can get them to adjust their rates based on that morning blood sugar. But it's very important also to see what the blood sugars are after your meals, because that may indicate that we need to treat you a bit differently if your blood sugars don't come down quite the way that they should after your meal.
A lot of people think that eating sugar, I mean, that we're talking about actually eating sugar.
Right. But
there are a lot of foods, and again, this can go to anyone, but there are a lot of foods also that you should probably avoid, that you wouldn't necessarily, I mean, the cakes and pies and those kinds of things are pretty obvious, but are there other types of foods like potatoes maybe, or rice, or things of that nature that could also cause a problem?
Yes, there actually are. And one of the things that a lot of our patients are able to take advantage of is going to see a dietitian, where they can break down the food groups for you, tell you exactly what to eat, teach you how to read a food label so that you really understand, you know, how you can tailor your diet to, you know, what your symptoms are and to help manage your diabetes the best. One of the things I think in the African American community is that we love to eat. We love to eat on many occasions, and so you can, if you meet with the dietitian, if you tell her what it is, how your lifestyle is, and how can I modify my lifestyle to, you know, meet my needs, then it becomes something that's doable. Because if you give someone a diet and you tell them, well, don't eat any carbohydrates, well, we know they're probably not going to stick with that.
Exactly.
So just tell them what good carbohydrates to eat. Carbohydrates with fiber. So, you know, I talked to the dietitian the other day and she told me oatmeal was good because it was a high fiber carbohydrate. So you want to, you know, eliminate those simple sugars, those simple carbohydrates, not white bread and white rice, but go for the ones with more fiber. And of course, you need to balance it out with protein and large portions of vegetables.
Veggies,
right.
Eat your veggies.
No supersizing it at McDonald's.
And minus the ham hocks.
Right.
Okay.
And minus the ham hocks, absolutely. Everyone doesn't have to take insulin.
That's correct.
Correct?
That's
so
correct.
you can control, especially type 2 diabetes, if I'm not mistaken,
yes,
with diet and exercise.
That's correct. And there may come a time if you are diagnosed with type 2 diabetes early on that you may need insulin. And there's this rumor that's going around that if you get put on insulin, then you're near the end. And that's not the case. You just may need a little bit of a boost from insulin to maintain better control. And some people are afraid of needles, and these are very serious barriers to health.
I mean, honestly, I think about that because I was like, if I had to inject myself every day, that would probably be an issue. But I want to live, so I guess you adjust. You learn how to
I watched
to live
my
with it.
father go through that process, and he was one of those folks who really didn't want to do it. And some of the classes that they offered at the time actually helped him work through it. And so he was able to inject himself, but at the same time, he wanted us, his family, to see him do it as a way to dissuade us from some of the behaviors that, put him in that situation. So,
Barbara, I want to ask you, what, from a family perspective, if a loved one you discover they have diabetes, what are some of the things that you did from a personal perspective that you tell other families that they need to do? Obviously, start paying attention, but just in terms of taking care of that person and helping them take care of themselves.
well, Dad was a stubborn guy. You remember that, and he liked to take care of himself, but I think he used it as a teaching moment for the rest of the family. And he was very critical at that point of all of the sisters, basically asking us to monitor our weight because he had become obese at the highest level when he was diagnosed with diabetes. And eventually he lost some weight, but he was still insulin dependent diabetic. And he was fearful that if we got into that weight range where he thought was the danger zone for us, so he would actually be the teacher. He would call us on a regular basis, ask us what we were doing to exercise, because then he got an exercise bike and he started doing some things to try to manage his diabetes. But with the rest of the things that were going on with him, it was just not a good situation, not a good health situation for him.
What do you tell your patients when they are starting to learn how to manage the disease?
I think that you need to get to know your patient and get to know what makes them tick, what's going to move them, because really you don't get control of your diabetes until you become religious about it. It controls you. So I think you need to find out what the barriers are and work with the patient. And to do that, you need time to get to know them. And in this healthcare system, unfortunately, we don't have a whole lot of time to do that. Some visits are 6 to 7 minutes, and you barely have time to open the door and close it. But we're very fortunate where we work, where we get to know our patients so we can make a real difference.
We've got about 2 minutes left, and Barbara, you are very involved with the American Diabetes Association. Tell us how our viewers can get involved. What do you need from them?
Well, basically, I need your time. I need your team, because every fall we create a team, and that team raises a certain amount of money, and then we walk down at the ocean front. So we're displaying healthy behavior, and we're also educating there because we have a number of different kiosks for testing and also information that you can share with your family, educational events that are happening throughout the year, and most important, we're just getting people to get out there and walk, and we give them an opportunity to honor the people who have passed away because of diabetes and walk in their honor. And because you were a good friend of Dad, Barbara, I want to present you from the American Diabetes Association. Your very own coffee cup.
Thank you, and I will cherish this very much. Absolutely. Henri, we got a minute left. What do you want to tell people in terms of research? Get involved in the clinical trials?
Absolutely. Get involved in research. We give you all of the information that you need to make informed choices. We aren't going to do anything to you that you do not give us permission to do. And at any point in time, you can tell us no, that you don't want to do that, and that is absolutely fine. But if we investigate and if we look at African Americans and we're able to determine what might be just a little bit different here and a little bit different there, and what signs and symptoms they have, then we might be able to treat it further. And so we're able to spend time with you, like Matt just said. We're able to help with the education, because that is the key, I think, to understanding just about everything. So I would just ask people to please come and participate.
Okay, and we got 15 seconds left, so you want to tell people just don't be afraid of it. Tackle
Don't be afraid of it.
head on.
I agree with Henri. You know, come in and get tested and get checked regularly with annual visits and get involved in research. It's a wonderful way to learn and to make a difference.
Okay, thank you all so much for joining me. I so appreciate it. And you know, Thanksgiving dinner can be particularly unhealthy for someone with diabetes, but when we come back, we'll go to the kitchen to learn to fix delicious dishes that your diabetic loved one can enjoy. But first, here's what's happening in Hampton Roads.
Healthy, but they're also
During the holidays, there are sweet things to eat everywhere you turn. But for the diabetic in your family, indulging in cakes, pies, and sweet side dishes can be dangerous. So our Lisa Godley asked Chef Dedra Blount to show us a few quick dishes we can make that not only a diabetic can eat, but that everyone can enjoy.
Dedra Blount is just one of our favorite chefs. It seems everything she touches just tastes fabulous. And today we're cooking for the diabetic, and you have your own story about cooking for the diabetic. You've been doing that for some time.
Absolutely. My mother has been a diabetic since 1989, so it was a tough transition for us having to switch everything from full fat, full sugar to preparing meals that she would enjoy, but also that would keep her healthy.
Okay. All righty. So what are we making today?
The first recipe we're going to do is going to be an apple pumpkin spice cake. One of the hardest things for diabetics around the holidays is trying to sneak dessert. I tried really hard to find a recipe that would be fulfilling, but also it would smell great, it would taste great, and it would kind of meet all their needs at one time.
Okay.
So in the recipe, the first thing we already have in the bowl is just a prepackaged spice cake mix. And then to that, you're going to add 5 egg whites.
Okay.
And that egg white is just going to help to make sure we don't have any high amounts of cholesterol. We'll have some protein in there.
Okay.
And then we've got 1 cup of pumpkin puree.
This is the pumpkin puree.
Yes. And make sure it's not pumpkin pie filling. The pumpkin pie filling already has the spices and the sugars added to it.
Okay.
So we're going to add 1 cup of cold water.
See, I'm not following instructions.
That's okay. And then we're going to add that to it and just go ahead and mix that all together.
Okay.
I'm going to use a tube pan, or you could use a bundt pan, whatever your preference is. And we're going to spray it really well. We're going to add pecans that are chopped. And then you're going to add sliced apples, 8 ounces of sliced apple.
Wow.
Now you're going to add your batter.
Okay. Yep.
Once we get it all mixed in, we're going to bake it for 1 hour at 350 degrees. Okay, now that we have the cake in the pan, we're going to place it in 350-degree oven for 1 hour. Okay? And while it's in the oven, we're going to make a glaze, an apple glaze to go over it. In this pan, all you need to do is pour 1 cup of apple juice. Okay, into that we're going to add 1 tablespoon of cornstarch. And then we're just going to put it on a low heat, and you're going to cook it until the glaze the juice goes from cloudy to clear. And then just set it aside, and then when the cake comes out, you can pour it over the cake. If you add too much cornstarch, when it cools off, it's going to get too thick.
It smells so good. I'd love to just have it sitting in the kitchen just to make it smell like the holidays. That is good.
Well, thank you.
Okay, well, we did things a little in reverse because who doesn't like a good dessert? But now we're going to work on a side dish for your Thanksgiving, for the diabetic in your family. And what are we going to do?
We're going to do a mashed sweet potato casserole. And you can either roast your sweet potatoes and then peel them, or you can boil them and peel them, or you can buy them already in the can. Now you're going to add to that a cup of brown sugar.
Okay.
And the reason why we're not going to add all of it now is because we're going to add some at the end across the top. Okay, we're going to add some milk.
Okay. all of this?
All the milk is fine. That's a quarter of a cup of milk.
Okay.
And then we're going to add 1 whole egg. And you can use your regular recipes, your normal holiday recipes, and just decrease your sugar content or your fat content by 25%. And I always spray the sides because you never know how high it's going to come up. You're going to add all of your mashed sweet potato mixture.
Okay.
Okay. With that extra brown sugar you have, we're going to add some whole wheat flour and then some margarine. Okay, and just mix that all up together. And then what we're going to do is just kind of drizzle it across the top. And then that's going to kind of form like a crust across the top of your finished product. Just because they're diabetic doesn't mean they lose their taste for sugar. You know, place this in a 350-degree oven for 35 minutes.
Okay.
Okay. And you can let it sit for a little while, or you can serve it immediately.
Serve it hot.
There you are.
I say that, and I'm going to have to blow on it. Oh, that smells good. It smells like sweet potato pie. Well, that's good.
Yeah, thank you.
I'd like to thank Chef Dedra Blunt for once again preparing delicious dishes for us. And you can find all of these recipes on the Another View website.
And for that sweet potato dish, Chef Dedra used brown sugar Splenda, so it was a sugar substitute. And I had a taste of those sweet potatoes, and they were absolutely yummy. And the cake was really good, too. And that's our show for this evening. We wish all of you a very happy Thanksgiving. It truly is a time to count our blessings and to help those who are less fortunate than we are. Don't overeat, and we'll see you next week on Another View when our roundtable pundits get together to talk about the issues of the day. We'll see you next time for Another View.
Production funding is provided by A. Reddix and Associates, Health Information Resource Center, offering short-term training for long-term professional careers in medical coding. HIRCVA.net.